To start with, I will give you a background about the study, followed by literature review from both sociological and medical consultation, and then studies from conversation analysis. I will then present data collection plus data analysis, and then I will go to make a comparison between two-party consultation, how to deliver news, bad news, in two-party consultation, followed by and compare this with how to deliver bad diagnostic news in a three-party consultation. I will show the findings, and then I'm happy to answer your questions by the end of this talk. So for this study, I aim to examine the three-party interaction in medical, three-party. I aim to examine three-party interaction in medical setting in Saudi Arabia. This study hasn't been studied before in a three-party consultation. What I'm looking at, I want to analyze the interaction between male doctor, Saudi female patient, and along with her chaperone. So what does it mean by third party here? A third party here in this context is a person who accompanied the patient in his or her medical consultation. This person can be a patient's spouse, a parent, an adult child, or a friend or a paid caregiver. The presence of the third party has been widely discussed in almost all healthcare settings, especially in pediatrics, in oncology and obstetrics, where the watchful presence of the third party can be seen with a woman during her pregnancy, during her labor and delivery. Also, the watchful presence of the third party can be seen or documented in geriatrics, also and also in chronic illness clinics, especially with ill demented person and cancer patients. The sociological and medical studies have documented the role and the effects of the third party in medical settings. And Edelman, he found the three major roles of the three party: advocate, passive participant, and antagonist. For advocate, I mean the third party can be a facilitator, acting as a facilitator, facilitating patient understanding, facilitating doctor's understanding, and facilitating patient involvement. Passive participant, the third party can be set as observer or passive observer or bystander. By antagonist, I mean the third party can be acted as discouraging the patient or opportunist. He can, for example, discuss his or her symptoms instead of the patient himself. Medical studies assess a three-party consultation from different views. One of these, I just concentrate on patient views and physician views regarding the presence of the third party. Patients have seen that the presence of the third party are helpful as well as satisfying in Prohaska and Glasser study. Whereas physicians also regard chaperone's involvement supportive to both patient and doctors, patient to 82% and doctors to 98%. In spite of all these or of huge observational and survey studies, there hasn't been no attempt till now to analyze the three-party consultation from different framework, which I'm going to use, which is conversation analysis framework. So let's now go to see how conversation analysis studies investigate the three-party consultation. So conversation analysis studies, which concentrate on the organization of the three-party consultation, really focus on the organization of three-party interaction. To my knowledge, there are only two studies that investigate doctor-patient third-party interaction, namely Stivers and Clementi. For Stivers, investigated the physician practices and selecting either the parent or the child to speak next. Stivers found that in selecting the next speaker, the doctor may select the child 53% or the parent 29%, or he or she may leave it ambiguous, like for example, how can I help you today? Clementi also examined how older pediatric patients from 10 to 18 years old initiate four types of action during the history-taking phase. These are a child his own answer search, child solicitation of corroboration, child solicitation of an answer, and a child's completed answer or completion of answer. And I'm not going to say all these of the findings, just one. For the child's search for an answer, the third party, who may be the mother or the father, may look at the doctor or at the patient to check the delay of the patient, and then the third party or the mother may intervene the doctor, telling the problem of the child or answer the doctor's question. The present study will expand on doctor-patient chaperone interaction by looking in more detail at chaperones' activities in medical settings. My case study is about three-party consultation in Saudi Arabia. So one of the cultural traditions in Saudi Arabia is that a female patient has to be accompanied by a third party or a chaperone to her medical consultation. This situation raises different issues. One of them, the interactional roles does the third party play in the medical consultation? In other words, does the third party take over the patient role? Does the third party align with the doctor? Does the third party align with the patient, or does the third party or do the third party and the patient work separately or individually, or does the third party sit as bystanders, eavesdropper, or passive participant? So for answering this question, I depend on, to answer this question, I took an approval from 3 hospitals, 2 private and one governmental hospitals. And to answer this question, I depend on audio recording. So I attend the consultation, acting as sample observer. I record the consultation. I collected 117 audio taped visits, 17 from 2 private hospitals and 10 from governmental one. And because of the 2 rate of Saudi female patient in the 2 private hospital, I managed to get approval from governmental hospital to collect my data, and I collected 100 from governmental hospital. And most of them are from oncology, 4 different clinics from oncology department: chemotherapy, radiotherapy, hematology, and surgical oncology clinic. For the transcription, I use Jefferson system of transcription into Arabic transliteration. For the case study, this case study is selected randomly from surgical oncology clinic. The female patient accompanied by a female chaperone. The female patient was referred by a male to the male surgeon and consultant. The surgeon has been informed to deliver the bad news to the female patient. So the patient hasn't known, and even the chaperone herself, that the patient has malignant cancer. So the bad news is that the patient has diagnosed with 4th stage cervical cancer. Why I chose this case? I find this case as interesting because numerous studies have been conducted on 2-party consultation regarding how to deliver the diagnostic news. But the difference here is the presence of a third party with the patient, where the doctor will diagnose the diagnostic will deliver the bad news. And because of the conversation analysis, depends on organization or to show sequence and talk. I use a conversation analysis framework to see how the doctor deliver the bad news sequence. For the framework, I use Myrand, and I adopt Myrand and the Frankel approach in news delivery sequence. This framework consists of 3 important points: introductory, preface to announcement, which is also consists of two components: inquiry and answer. For diagnostic news delivery, there is announcement. I use color here in order to show you in the data. Announcement response, elaboration, receipt, and assessment. Before I show you my data, I want to see how this framework has been conducted in 2-party consultation, and then I will show you the difference when 3rd party is present. Let's look at doctor-patient interaction during news delivery sequence. So we have preface. So the doctor here asks the patient, do you remember we said we saw something growing in your stomach? So the patient, this is the first preface. The second one, do you remember that? Let's look, and the doctor moved to the announcement. There is something growing in your stomach. Announcement response, you can't tell what it is. I can tell you what it is, client. It's cancer. So here it's the elaboration, and then look at the assessment, where the patient whispering, and then the patient reject, oh no. So let's look at the 3-party consultation, how the doctor delivered the bad news. In this data, I have more than 5 prefaces, so I concentrate on 3 prefaces only. The first one, has Dr. Sarah exactly explained your case, or look at the female chaperone here answer. So the patient said, yes, she has transferred me here. Pardon me, the doctor asked for repair. Patient, she said nothing, she only transferred her here. And then there's an overlap between patient and female chaperone. Nothing, she said nothing to her. And the patient said, she transferred me here. So female chaperone acting here as a patient interpreter, facilitating patient understanding. Let's look at the second preface. No, hasn't she explained what the treatment result is and what we reached to? Look at the prefaces and the difference of the female answer. So each time the female chaperone carries out different activity. No. So the female chaperone aligns with the patient here. So both of them answer. So the female patient support the patient, align with the patient here. Let's look at the third one. Okay, has she explained to you from the beginning the beginning of the medication, the kind of disease you have, or hasn't she explained the disease? And so the patient, the talk of her, the patient here is not clear. Pardon me, sorry, raise your voice a little bit in order to hear. So the patient, the female chaperone here, align with the doctor, raise your voice in order for the doctor to hear you. So the female chaperone here aligns with the doctor, acting as patient-doctor mediator. Let's look at the fourth preface. So the doctor up till now hasn't announced delivered the bad news. The fourth preface, before Dr. Sarah has prescribed the radio and chemotherapy, has she explained your case? Has she informed you the exact disease you have, or the exact disease you have, or hasn't she explained? And then the patient replied with something which is not clear. Pardon me, the doctor asked for the repair. The patient now announcing the bad news. She doesn't know that she has tumor in a very quiet voice. And the doctor, here the doctor announcement. She has what? I mean, she has a tumor in uterus. Yes, on cervix. So the doctor here corrects for the chaperone. Yes, on cervix. This tumor is on the cervix. So the female chaperone acting here as a doctor, as a doctor facilitator. Let's look at the operation as elaboration here. We should remove the bladder. So the elaboration here, we should remove the bladder and take out the rectum. We will change the flow of urine and stool. This is the only solution. So the female chaperone is acting as interpreter here. Let's look at the assessment here, which is really difficult. So the female chaperone now rejects what the doctor said. I mean, up to now, she when was admitted in the hospital, that it has been taken out. So they thought that the patient has a benign tumor, not malignant. Female chaperone, she understood like this, and the doctor said, no, who remove it? Female chaperone, I mean, this is what she understood. So female chaperone here is acting as a patient substitute. For the findings of the study, delivering the bad news is different from three-party consultations. I know that although it's difficult for the doctor in a two-party consultation to deliver the bad news, but it takes longer in three-party consultation to deliver the bad news. The female chaperone breaks the news, the bad news. The female chaperone carried out different activities in the medical interaction during delivery news sequence. For example, she aligns with the doctor, aligns with the patient, facilitate doctor understanding, facilitate patient understanding. Thank you for.
Time for questions?
With the transcript that you have the particular answer that the title comes from, she doesn't know that she has a tumour.
Yes.
The female chaperone, who is she exactly? Like,
She is not. She is her husband aunt. She is not. It's not immediately her relative, but she is relative from her husband.
okay,
point
so a
of view.
family
Yeah.
connection. So how did she, I'm sorry if I misunderstood, but how did she have that information about the patient's medical state before the patient? How come she knows? Like, how is she able to say she doesn't know that she has a tumour? How come the female chaperone knows about the tumour first?
They thought. They thought both patient and the chaperone. Before that, when I filled the observation sheet for them, I asked the patient what the problem and what kind of visit she is it the first or follow up, and she told me I have benign tumor and it has been taken out, and also the chaperone told me the same. But the problem here is both of them they was shocked. The one who knows the problem exactly is the female patient's husband. So he knows that everything about the problem of the patient, but he doesn't tell the patient.
But he has told, what did you say, was it his aunt, or he has told this female chaperone?
Yeah, the female chaperone. Yeah,
She understands
yes,
how
yeah.
serious
But
it is.
she doesn't know that the kind of tumor is malignant. Yeah.
Okay.
And this is what we observed there. Some of the, while I was collecting my data, most of the talk, I mean, when the doctor, patient, and along with the chaperone attend the consultation, the male chaperone asked the female patient to go out in the waiting area in order to discuss the problem. So the male chaperone and the doctor are the ones who know the patient problem,
Not the patient.
not the patient. I mean, some of them, not all of them. Quarter of my data, the patient don't know the kind of disease they have.
Is that quite frequent then? So that if you have a female patient, their husband will know the problem but won't necessarily tell them, or is this?
Yes, some of them, but not all of them. I met really wonderful chaperones during my my data collection. Wonderful chaperone. The patient knows everything about her illness. But some of them, especially older patients, the adult child, they, as a dominating person, they don't tell their mom or their grandmother, the problem that she has, in order not to lose hope or to think that they will die sooner.
Other questions?
Can I ask one more thing? What are the differences in the rules regarding male patients versus female patients in terms of chaperones? Like, are there different systems depending on the gender of the patient? Because I think you said at the beginning it was obligatory for a female patient to have a chaperone. Is that correct?
Yes, but what I have faced there when I collected my data, yes, the male chaperone is the one who accompanied the patient, but especially the patient who come from different or far cities or towns, so they tend to come with them for transportation. Otherwise, no. Since the nurse is in the consultation with the male doctor, so the patient can enter the consultation without the chaperone.
Because the nurse is
The nurse,
And how does it work if you were collecting data about male patients? Would it also be obligatory for there to be a chaperone there, or would it be
For male,
for male patients?
I haven't collected data from. You
No,
mean
but
for
I'm just saying
male patient or male chaperone?
Male patient.
No, I concentrated on Saudi female patient
But
only.
would they need a chaperone?
No, I don't think so. But
So it is
especially,
different.
from my readings of previous studies, especially older patients, they need someone to accompany them, and they have them, for example, for emotional perspective, for transportation, for accompaniment.
Are there any differences between the types of interaction you get with a female chaperone and a male chaperone? So are there distinct linguistic or types of alignment that shift
Yes.
between the two?
Yes. Men tend to be dominant more than women.
So do they typically align with the doctor, or does that vary?
Some of them align with the doctor and some of them align with the patient. It depends on the patient's case.
But by dominating, do you mean they usually sort of substitute or represent the patient rather than let the patient speak themselves?
Yes, yeah.
And I'm assuming that all the doctors are all male? And the surgeons? I mean, are the doctors all male themselves here?
Most of them, yeah, most of them.
Okay, and would a chaperone be needed if it was a female doctor?
They prefer, yes, female doctor instead of male doctor, but if there is none, so they tend to go to.
Would they still need a chaperone, a male or female chaperone, to take them, not to take them, but to sit with them in consultation with a female doctor?
So if it's the case, just a female patient and a female doctor, would they still need a chaperone in the consultation?
Not all of them. If there is a female doctor who is treating the women, so no need for the chaperone. And also it depends on the type of the family,
Yeah.
and also on the need, the patient's need for the chaperone.
And when you say sometimes the chaperones act as interpreters, do the doctor and the patient speak different languages?
No. Like for example, I will show you from my data. Like for example, when the doctor says something, and the patient doesn't understand, so the patient, the female chaperone. Let me give an example here. Yes, it should be a sentence after that. Yeah, but I remove it because there is no much space here. Yeah, did you understand what the doctor just said? So, and there is also another line where the patient explained for the female chaperone explained for the patient what does the doctor means by that. For the treatment, they remove bladder and rectum. So he I haven't got it here, but there is also another line where the female chaperone explain in a very clear way what the doctor wants her to do.
Have you come across some cases in which the chaperone is trying to help? Turns out that he's explaining things worse than the patient and the doctor. So failing as the interpreter role. Does that occur in failure?
I find the opposite, where
So he's
not
usually-
this one, not this type. I found the one who's acting as antagonist instead of, for example, explaining the history of the symptoms of the patient. She asked the doctor, "Oh, I have cough. What would you please give me? Can you give me a medication for this?" So, and the patient sit with him. So he ignores her completely, and this I remember. No, this one is his daughter, not his wife. So instead of saying or the symptoms of his daughter, explain symptoms.
Any more questions? Okay, thanks very much.